Hello colleagues, and thank you for tuning in to another episode of Transforming WHO. This is a series of video interviews where I talk to colleagues inside WHO and outside about what we do in WHO and about reform and change of the way we work. And today I'm joined by Liviu Vedrasco, who's the head of the WHO country office in Kyrgyzstan. And welcome to the studio here in Geneva, Liviu.
Thank you.
I was very fortunate to just catch you while you were here visiting in Geneva, and you could join me in the studio. So first, a little bit about yourself. I mean, you started actually as a nurse, then you became a medical doctor, and then you worked in public health in your home country of Moldova. But fairly early on, approximately 25 years ago, you went to work in the field in many different capacities and countries around the world. I believe we have a picture of you here 15 years ago working in the field. This is you reporting on the earthquake crisis in Haiti. We have another picture of you in Sierra Leone, I believe. So that is 10 years ago, the outbreak of Ebola in the West Africa, and you were also responding to that. You worked in Senegal, Myanmar with the Rohingya crisis, Bangkok during COVID. You were in Bangkok actually responding to the COVID pandemic. Then a couple of years working in emergencies here in the headquarters in Geneva. And then 2 years ago, you went to work in our country office in Kyrgyzstan.
Yes, that's
as the head of the country office. Why did you go and become a WHO representative in Kyrgyzstan?
Thank you for the question. Actually, it was a very simple decision. I always wanted to experience this role. And in fact, in Thailand, before coming to HQ, I was deputy WR.
Yeah.
So I tasted this. But I like this, and actually there is a lot you can do. There is a lot of autonomy, there's a lot of freedom, creative freedom, and you have lots of partners you can work with, and you can shape certain agenda. You can pick up issues, and at that time, Thailand is one of these countries that they had 7 country cooperation strategies. They are probably the veterans of country cooperation strategies, the document that sort of defines what WHO does in a country. And Thailand always said, we believe in this, we invest in this. And actually, I think they are one of a few countries, if not the only country, where the government of Thailand is investing in the programs that are decided jointly between WHO and Thailand is their health insurance company, which is completely if you say to someone in Moldova or in Sierra Leone, it's the government is putting money into WHO at the country level into implementing something, they will go and this is outside ACVC. This is just locally, and it doesn't even go through WHO accounts. So it's a very creative methodology.
2 years in Kyrgyzstan.
Yes.
Kyrgyzstan is a fairly young country. I mean, more than 30 years being independent. So, of course, a lot of challenges as a young, small mountain country, but also they've done a lot of progress. But can you describe what you do in Kyrgyzstan in the country office?
Actually, that's a very nice question, because when I came, I tried to figure out, of course, I tried to study and do some homework before I went there. And I realized that the WHO was there for 28 years and a half. And I was trying to Google, try to look on our intranets, where is the country cooperation strategy? Because that's a document, what WHO does in a country. And it's not there. So I called the people in Geneva, don't they have a country cooperation strategy? No, we don't. So when I came, I studied, I looked at the HIT reports, health in transition reports. And they had one recent. It was there. So the problems were there.
And what are the challenges in the healthcare, public health in Kyrgyzstan? What are the biggest challenges of Kyrgyzstan?
Well, the biggest challenge is you have some infectious diseases that are still there.
Yeah.
TB, HIV.
Yeah.
And also
actually a fairly high prevalence of TB and HIV.
Absolutely.
Yeah.
And it's not, the job is not done.
Yeah.
But when I came and saw that there is not a country cooperation strategy, I said, no, this has to be fixed.
Yeah.
It has to be
the
done.
other public health challenges in Kyrgyzstan, I believe they also still have a high maternal mortality, even though they have tried to bring it down.
I think that one is relatively, of course, you just mentioned that I was in Sierra Leone. There was
It's just I'm an obstetrician by background, so any maternal mortality above a very, very low level.
Absolutely.
So when I looked at that, it's still a challenge. Adolescent pregnancies, I mean, access to family planning, still a challenge that they are working with in Kyrgyzstan. And then, of course, as in many, many countries around the world, a high burden of NCDs, non-communicable diseases, and an increasingly burden of non-communicable diseases.
And that's why when we came and said, we need to have a country cooperation strategy, I looked at different models. Of course, I was very much influenced and, inspired by the Thailand experience, and also looked at many other countries that have good country cooperation strategy. What do I mean good? What is a good country cooperation strategy? A good one is it has very limited number of priorities, and for each priority, it has a baseline, like what are you trying to fix? How bad it is? And what are you going to do to get it from this baseline to this target?
And the country cooperation strategy is basically a WHO document that we develop with the government, the Ministry of Health, basically laying out what are the priorities of the government and how can WHO support that. Because that's our core role. I mean, WHO starts and ends with our member states. We work for the member states, we support them. And I think you actually brought the country cooperation strategy.
That's it. Yes, that's the strategy. And I'm very proud of my team who put it together in record time. I arrived in July 23, and it took us about 3 months to get it right. Of course, it took the homework and everything. And we have even for people, very busy politicians, they don't have time to read big documents. So I even have a back. All the 7 priorities are on the back cover.
So they don't need to read the book.
They don't even need to open the book. At least they look at these 7. So these 7, of course, I mean, hypertension, emergencies, mental health, AMR, climate resilience, chemical safety, human resources, and digital. Just not to read all the words. But they are not too broad, because some of the worst, not the worst, but some of the not optimal country cooperation strategies I saw 10 years, 15 years ago, they say we have 3 priorities. The first priority is communicable diseases, the second one is non-communicable diseases, and the third one is health systems.
That's basically everything.
I mean, it's like, that's nothing. So what are you trying to achieve? But here, this 7, and also I love good marketing, because you need to communicate to politicians, you need to communicate to donors. So we chose first 5 priority, then I came with a 7, and then another decision about country cooperation strategies for how long. You cannot do something for 100 years. We don't live so long. But
so this one is actually 7
years.
So is that aligned with a national strategy planning period?
Absolutely.
Or,
So this, I mean, there was options. I could align with JPW 13, 14. I could align with a UN country team. But I decided to align with SDGs period. 2030, the agenda 2030, and also with the government. They have a plan until 2030.
And of course, we have some very specific goals for SDGs for 2030 that we are not quite on track, but we need to basically escalate and accelerate progress. I have a picture actually from healthcare in the field in Kyrgyzstan. And here is actually, I really like this picture because Kyrgyzstan is a very mountainous country. Of course, people increasingly move to the big cities, especially to the capital of Bishkek, but there's still a lot of people living in very rural areas. And this is a healthcare worker, and she actually travels on horseback to reach some of these mountain villages with vaccines and other essential public health elements. I really like that picture. I mean,
absolutely. I love this picture. We put it on so many publications because it really symbolizes Kyrgyzstan. And also, I mean, you said about movement. Migration is a big issue. But
because of where it's situated.
Yes,
so
a lot of movement. But compared to like my native country, Moldova, where every second person lives in the capital, in Kyrgyzstan is only every 7th person. So it's still a lot of people, 6 million, are living outside Bishkek, which is different from if you go to any Central European country or any other country where you have a high concentration in the capital. So people actually do live in very remote areas. And back to the country cooperation strategy, if I may, because I love this document so much. And it's not just a document, it's our roadmap, is also Kyrgyzstan has 7 regions. So 7 regions, 7 years, 7 priorities. And why are regions important? Because we attach, at least symbolically, if not fully, we attach one region of a country with one priority. So AMR, for example, we have Osh, this is the region of Osh, which has the better laboratories. They're leading. So it's a sort of, if you want, South-South cooperation, but inside the country. Yeah. So if Osh can drag Talas and bring them closer, then that's a very good thing, in my view.
Yeah. So 2 years in as WR, head of the country office in Kyrgyzstan, you're very proud of the country cooperation strategy, but what other achievements are you very proud of in your 2 years in Kyrgyzstan?
Well, I think one achievement, again, back to communicating and clarity. Whenever I speak to the donors or to the government, I can communicate very easily what we do in the country. Yeah. It takes me, I can do it in 30 seconds. I have a 30-second version, a 90-second version, and a 5-minute and a 10-minute.
And do you have data to support that?
Absolutely.
Is that a data-driven?
Absolutely.
Yeah.
In addition to this country cooperation strategy, we commissioned and we worked as a team to do a monitoring and evaluation plan for micro-planning every intervention. Oh, yeah. So, of course, hypertension is big. But we're going down to salt consumption. We know what's the baseline. We go down to trans fats. We go to the legislation. We go baseline. How many people are treated for hypertension? How many? What's the opportunity cost? What is, what can be done? And we've mapped it all. And we also know how much it costs. And we also have a funding. Yeah. And we have a staffing. Yeah. And also another thing I was very proud of and still very proud of, because the office was very flat structure. I came and I discovered in our system, that I have 20-something direct reports. And as a manager, my whole life, I know this doesn't work. Yeah. So restructured the office, have team leads, and I don't have more than 5 reports now. Oh, okay. The 3 team leads, the communications person, and the assistant, and that's it.
And basically this data-driven, results-focused way of working has been central to the WHO transformation agenda. That's one of the strategic thrusts. Another key focus of WHO transformation is strengthening our country offices and also empowering people like yourself, the heads of the country offices. We are still working on that. We are not by far where we should be, but we have invested in our country offices. We've allocated resources and empowerment. What more can we do, Liviu? Are we walking the talk? I mean, in this current situation, any more new ways of working, innovations to further strengthen our country work?
I think the intention is there. I think there are good beginning of good systems. Yeah. I think the fact that we have a WHO representative roster and how the WRs are selected is also important. I mean, it's also new. I mean, people think that it has been there forever, but it's only a few decades. Yeah. So this is important. The delegation of authority, which was increased. What is delegation of authority? Maybe people don't know what that means.
Basically means that we give you power to hire, recruit, and spend, etc.
So that's there, but it's still. You have things that are written and things that are not written. You have prevalent practices that are hindering. They're not written, but this is, I mean, one thing.
So it's in our culture, you might say.
It's a culture, and it comes in this type of phrase. I remember I went to Myanmar, and I was greeted, and everything was fine. I was given a desk, and then I was assigned free assistance. I'm like, my goodness, what I'm going to do? It's like, oh, she will do this. And say, I don't need all of that. I remember, like now, he said, oh, this folder, after 1 month, someone said, oh, are you okay? Are you feeling okay? I say, why? Oh, you didn't give me any medical claims, reimbursements. I say, why? I think, but I'm, this is a private matter. I'm not gonna.
So there's still efficiencies and new ways of working,
yes,
etc.
Yes.
So currently we are in a crisis. I think it's fair to say for global health. I mean, we've lost a lot of funding with the withdrawal of the U.S. not only from funding WHO but programs in global health in a broader context, but it's also already a constrained funding in global health and many challenges to the way we work. I mean, you worked in the field for many, many years. Now you're in a country. How do you see that current challenge we have?
I think this is because I've lived through a number of these, and I would say this one is not a cyclical, decade cyclical. This is something else. Yeah. In economics, you have recession cycles, 10-year, sometimes 15-year, and then you have the 100-year cycles of economic transformations. I think I would be safe to say that this is probably could be characterized as one of these larger changes. That is not something that was like 2007, 2008 financial crisis. This is
it was a bigger challenge.
Challenge.
So how should we respond in this huge challenge, this crisis? I mean, we need to rethink the way we work in WHO, our efficiencies and way of working. Do you have any suggestions on how we can basically in this crisis come out of it well?
I think it's good to stay on the core, on the essence, and stay focused on what we are supposed to deliver in the countries, but also at the global level.
The core mandate.
Core mandate and things that are transnational in nature. Something that only countries coming together can solve. Something that has implications for the whole of humanity. Something that is not purely a role of a sovereign state and it doesn't matter.
Basically, health for all, our normative technical functions, our support and guidance to governments, that's what we need to focus and do that.
Absolutely. And also, of course, in the area of health security. That is a great concern. And that we cannot do without cooperation and solidarity and sitting together.
So we can respond to the next pandemic or crisis.
Absolutely. Pandemic preparedness, I spent half of my career, 15 out of 30 years. If I don't count all the years, this is what But
it's like sometimes you kind of feel like there's a collective amnesia. We had a pandemic that hits us 5 years ago, and it's kind of like we're forgetting that, but we need to
I disagree. I disagree with this because I hear this a lot, like, oh, we're not learning, lessons learned, we forgot everything, panic and neglect. I don't know. I mean, humankind, they just like to criticize themselves, and I see a lot of improvements and even increased levels of preparedness. And I saw it when COVID happened. Of course, there's always someone who's going to criticize. But if we did not invest and did not do all the preparedness in 2005, 6, 7, because I used to work in a bird flu, and people didn't know what contingency planning is. Now every nurse knows, or every hospital director. We just forget how much we learned. We forget how much we advanced. Because we think it's not perfect.
So those lessons learned are there in the system.
They're there. They're there.
I will certainly never forget. I mean, this is in my professional life, the COVID pandemic is the biggest thing that ever happened. So I'll never forget it. I guess the same for you, right?
Yes, absolutely. Absolutely.
There's also many voices saying multilateralism in itself is being challenged, and we've seen that over the years and certainly in the current context. Do you agree? And if so, do you see any way out? Do you see a future for multilateralism?
I see a bright future. I see a bright future. And I think if we look in history, even if you look at global health, even pre-WHO, pre-48, we have a League of Nations. And then even before the League of Nations, and every time we invent a new health organization, it gets better. And sometimes maybe it goes astray, and sometimes maybe it goes a little bit off. But overall, I think the trajectory is positive. I've been actually, I just remembered today because I was talking to colleagues about WHO, I actually came here 25 years ago. In 2000, in September, I was on an advisory panel for essential health technology package testing of a software. Imagine 25 years ago.
Yeah.
And I just remembered, oh yes, I was here. And I remember the atmosphere, the type of conversations. I think we evolved. And I think, yes, things can be improved, but overall I see great potential and great future. And I think this is not the end of multilateralism. And I believe that, we will not only reinvent and renew, and, we will look at this maybe as a period of great learning.
Thank you very much for that optimism, Liviu, and thank you also for joining me here in the studio and sharing your experiences from the field. And good luck with the work in Kyrgyzstan. And thank you, colleagues, for watching this episode of Transforming WHO. And do stay tuned on this channel for upcoming episodes.